Today, we're going to go over a ton of questions that I think you should ask when you are being interviewed for an NP job or a PA job or really any kind of healthcare provider job. You're going to learn from my mistakes and you're going to ask these questions so you get a better idea of what you're walking into. All right, ready? First, is this a new position or are you replacing a clinician who left? And this is important because it's going to tell you a lot. One, how is the practice doing? Are they expanding and they're adding you on? That means you're going to have your own whole panel. The business is probably thriving if they're bringing a new human on in addition to the ones that they already have. That's a good thing for like longevity of the company. Second big thing it'll allow you to ask then is about retention. Oh, people are leaving. Do people leave a lot? What does turnover look like in this office? Not only with the clinicians, but with the staff overall. It opens the door for that whole question. It tells you a lot about your patient panel, right? Because if someone left, are you acquiring all their people? What does that patient demographic look like of the person who left and now you're going to be acquiring all their things? There's a lot that goes into that. Maybe you wouldn't like that. Maybe you also want to start fresh. Maybe they saw a patient population that you're not like, that's just not your special interest. Like maybe you love pediatrics and women's health, and this person primarily saw people over the age of 65. That is something that you're going to want to know. Okay, so starting off with asking, hey, am I being added on or am I replacing someone? Opens the door to a whole lot of questions and just gives you a general vibe of what's the turnover like, what is the health of this practice. The next question leads off of that first one. If you are acquiring someone else's patient panel, can you see those as a new patient visit? Because they're new to you, they're not new to the practice, but they're new to you. So new patient visits are typically longer than a established patient visit. They give you a bigger time slot because it's billed at a higher level when they're truly new. Can you have a new patient slot? So it won't be billed that way, but you are still getting to know them and need to have that extra time to go over all of their records, get to talk with them, maybe adjust the charting in a way that makes more sense for you. Like I recently came into a practice where I had to go in and like basically input everything into a different area of the chart of like how I'll be using it. And that took a really long time. And I wish I had asked for longer, just schedule this as a 30-minute instead of a 15. Obviously, they're not going to bill the patient as a new visit, but will they give you the time to make every patient that you're seeing who is new to you a new patient slot? So AKA a longer time period. That I wish I had done. I'm finally out of the zone where most people are no longer new to me. I have all my own, but like, that was horrible. The next one is who decides how long you get for each appointment time? And if the office is the one that's deciding for each appointment time, how is that decided and what do those times look like? And here's a comprehensive list of the different type of visits types you can expect if you're in primary care. You will want to look at new patient visits, adult physicals, well child checks, acute visits, sick visits, hospital follow-up, transition of care appointments, procedure appointments, gynecologic appointments, med checks, chronic visits. Are there more? There are probably more, but those are the basic ones I would ask about. I would also ask, are you allowed to go in and tell the front desk, hey, I want 30 minutes for this patient? Yeah, it's just for a med check, but I'm going to be able to bill them higher. I know I'm going to be able to do that because they have a lot going on and these visits always run over and we certainly have enough time to bill to a higher level. So can we have 30 minutes? Or do they not let you adjust your schedule at all? In which case, that's all I'll say. While we're speaking about the front desk, do you allow the front desk to double book you? Some places will double book you, assuming that they're going to have a certain amount of people who no show and things like that. I would like to keep that time. I wouldn't want to work where someone double books me on purpose, kind of like an airplane, hoping that some people won't show up. If someone doesn't show up, that's a gift to me. And I would like to use that time to chart and get caught up on other stuff. In reality, that's just me like maybe running slightly less late that day, but are they allowed to do that to you? You're also going to want to ask them about admin time. This is time set away for you. What does it look like? Do you get some every day? Because you absolutely need some. We're not even going to ask, do we get some? It's how much admin time do I get? Do they have certain days a week? Like, could you have one whole day of admin time? Could you do that at home and have that be instead of doing an hour at the end of every day? Could you take a half day on Friday and go home and do your admin time then? However it's situated, what does it look like? Is it flexible? Another thing to consider here is, are you salary or are you hourly? If you are hourly, will they somehow keep track of, hey, if you get an hour at the end of each day, what if my technical day ends at 5, but my last patient left at 4:45, so then I should be paid for an extra hour to do admin time. Do I still get that hour, or do you see the 15 minutes and you're like, well, that's enough? Is there a routine meetings of all the different healthcare providers in the offices where we can come together and present cases to each other and bounce ideas off of each other and talk about things that have come out in the healthcare world that maybe we think the other people should know about, and just offer a space that is solely there for collaboration, for you to be able to go to your peers and run things by them? How available are other people to you? Like, I work in an office where there are lots of other people, but it can be hard to find that time to come together and present cases. I did my clinical at a federally qualified health center, and they had twice a week, everyone came together and they paid them through their lunch. And during the lunchtime, everyone sat there and presented cases to each other and were able to get some insights. And that would suck to lose your lunchtime, but I honestly, I would do that in order to gain the insights. So you don't have to do it that way, but is there some other opportunity for something like that to happen? Because I think that's a huge opportunity for growth and support in your own practice, which kind of leads into the next one, which would be, I would always ask them, what do they think the office culture is when it comes to collaborating with other providers and doing little pulling them into a room and being like, could you look at this rash for me? Is that generally something that is encouraged? Obviously the admin who you're interviewing with or the practice owner is always going to say yes. And I can do a whole separate video if you want of questions that I would then ask when you shadow, because that's a question you always need to ask is, can I shadow? And if the answer is no, you don't want to work there. Let me know if you want that video of what to ask people while you're shadowing, but just get a general vibe of at least what the admin or the practice owner says when you ask this. It'll be interesting. I'm sure it won't be totally truthful. They're gonna be like, yes, this is the best place to work. Everyone's so collaborative. We're a family. Just for fun. Just ask. You're also gonna wanna know what the staff in the office, what that situation is. What is the MA situation, the nursing situation? Do you get your own MA? Or is there an MA team and you're paired with someone every day? What's the ratio of MAs? is it 1-to-1, one MA, one provider? Or are you sharing an MA with other providers in the office and they're running around like a chicken with their head cut off? I personally find incredible value of being able to have one MA that you work with so that you can both learn each other. I can learn how to best communicate with them and how they like to work and how I can work with them. They understand what my workflow typically looks like and how it's best to communicate with me. They know what my answers are to a lot of things, like when patients call in, because we've worked together for a long time. It just makes the working relationship a lot easier if it's one of you to one of you. It's also helpful to know, what does the nursing staff look like? Is there a nursing staff? I've worked at an office where there was no nursing staff. So you handled everything that was outside an MA's scope of practice. Where I work right now, we have one nurse who shared between all 6 providers. So we do have to do a lot of our own triage, a lot of our own refills, a lot of the tasky stuff, because there's only one nurse and she's not even there full time. And that's the reality of a lot of small offices. In a bigger setting, that wouldn't be the case. How many nurses are there? What are they responsible for? What are they doing with triage? Can they send in orders? What's the vibe there? Basically, what is your support in this department? Do you have a biller? Is the biller nice? Are they understanding that I'm just not good at that? Okay. I'm just not good at it, but thanks for being kind. You know who you are. Who handles the prior auths? Maybe the most important question of all. Who does this dreaded task? Because I feel like this could be a full-time task. If you work in a bigger office, I am sure that there is someone who only does prior auths. A huge waste of time. I have worked somewhere where I filled them out. I asked for way more admin time in that case because it takes a long time to do those. I currently work somewhere where someone else does most of the work, and then they come to me if the templates we've pre-filled out don't fit or they need some more backup. So ask who does a lot of the heavy lifting when it comes to prior auths. What procedures are going on here? That's good to know. Okay, maybe you're not a procedure human like me, but you would like some things to be in the lab. Are they super into doing skin biopsies? Are we injecting people with things? Is there an ultrasound thing you're supposed to know how to use? Are we doing IVs in the clinic in case someone's dehydrated? Do we have a microscope to be able to look at slides? What's our lab look like and what's the vibe? Are we drawing blood on people? What kind of medicine do we keep in stock? What are we routinely giving? Are we suturing a lot of people up? What is the expectation for you when it comes to all of that and isn't negotiable. Traditionally, where I've worked, I don't like procedures. I will do them if I must. I, in general, don't love them. I could do pap smears all day. So I tend to do a lot more of those type of things. Sometimes I'll freeze off your wart if you really need me to. A lot of people are like, I hate doing pap smears. So I'm like, I will do all of them for you and use, stitch people up and skin biopsy them and all of that type of stuff. So just get a vibe of, do we do a lot of those here? Are we even equipped to do those? This kind of goes back to the staffing, but it takes up a ton of workflow time. So it got its own question. Who does the refills? Who handles your refills? As someone who handles most of their own refills, I hope for you, someone else can do it. So just ask. And if not, you can bring that up and tie it back to like needing more admin time because they take a lot of time, because it's not just refilling. And you could remind them of that. I have to go in, look at the chart, see if it's appropriate. Have they been here lately? Viewing the last note. Did anything change since they've been here last? Because you're not going to remember it off the top of your head. So who's doing those for you? Okay. How long do you have to close a chart after the visit is over? Is there a institutional policy that says you have a week after your patient leaves that we need to close the chart and send it over and submit it to insurance? What's your wiggle room time? Okay. And all of that comes back to admin time. And who do you talk to if this is not working out? Who's your point person? If you're just like, I am losing my mind and can't get anything done and I'm so behind, who is your resource and what resources do they have to help get you across that finish line? Next, you're going to want to ask about the technology situation. Okay. Does your office implement something like DAX Copilot, like the AI scribe? Do you have a portal system? If so, what is the expectation of how quickly you would respond to patients' messages that come through there? Do they expect you to respond to patient messages when they send them like on days that you're not working? I've heard of that happening. For me personally, I tell my patients when I meet them for the first time that, hey, we have the portal. I check it on the days that I'm here, and I usually only check it once a day. So if anything is urgent, you're probably going to want to call the office a different way, but it's a great way to reach me for less urgent things. And that's worked well. You're going to want to know. I should have put this towards the beginning of the video. I just wrote these down in like whatever order they came to my brain. You're going to want to know what the patient population is that you will be seeing in this office. Does this office see a lot of kids? Do they see a lot of adults? Is there a special population that comes to this office? Like the practice that I work at now, the owner has historically worked with a lot of people who work in group home settings. And when they come in, they have to come into the office every 3 months for paperwork and for med checks. And it's a very structured thing, but it involves a lot of paperwork. And it's not necessarily a population that I have a lot of experience with. So that's been a learning curve. And I had to ask who is going to be my resource and my point person for this, because this is just not something that I have experienced before. Obviously willing to learn, but like I'm going to need more ramp up time for that versus maybe routine well child and like adult primary care type stuff, because I've done that before. So find out, and maybe you'll find out it's a special relation that you are not interested, in which case that would be helpful to know, or you're going to learn a really sweet new skill, which will be exciting. So find out what the workload is associated with that and who is there to help you with that workload. That's something that I'm now having to retrospectively navigate. And I'm telling you, it sucks more that way to be like, hey, I need help with all this paperwork that comes with this specialty population, because I did it for a long time. And then I was like really getting burned out. And now I'm having to go back and be like, I'm going to need help. And they're like, well, you did it for so long. Don't do that. That's not the way to do it. And while we're talking about resources, what are your resources? Who are the resources in terms of providers you can reach out to if you have a question and you don't know something? Who is your resource within the office in case things, like I said, just are not going well and you need help and you feel like you're drowning? Do you have resources? Do you have plans of how to make improvement and get things better? Or are you just, well, good luck out there? That's not the vibe. We don't want that vibe. And we always want someone we could call when we have clinical questions. The person who owns the clinic, I don't think he's ever let the phone even ring twice before he picked up when I've been like, I don't know what to do. So that's the vibe you want. Okay. Vacation time. Who covers you while you're on vacation? What is their responsibility? And what are you expected to do when other people are on vacation? What's that look like in your office? Are you supposed to do other people's refills? Are you answering their patient questions? Do you split it evenly amongst all the providers in the office? Or are you assigned a point person and you have a relationship like I cover you, you cover me? What's that vibe look like? Call. Do you have to take call? What does that look like? Do you get paid for call time? Do you get paid for calls that are like longer than a few minutes? What is the expectation on call? Can they call you in the middle of the night? Is this, you're supposed to be doing like virtual visits, or is this really just like hey, you have a quick question. I can either tell you to go to urgent care or that can wait till Monday. What's the vibe of call? CEU money. You're going to want to ask about that. Do you get paid time off in addition to your PTO to do your CEUs? Do you get money to do CEU type things and take the classes? What do you get reimbursement for, like your license and your DEA? What's the reimbursement on all of that type of stuff? Because this is expensive. What's the policy on late visits? A lot of offices will be like, hey, if you're more than 15 minutes late, we're going to cancel you. What's it look like here? Does your office accept walk-ins? That's all going to let you know. And if you're like a type of person who like really likes, obviously we all like to run on time, but like it really drives you crazy if you don't run on time. If you work at an office where as long as the person shows up, they're seen, that might make you insane. Is it up to provider discretion? That's how it is in my office currently, is they'll ask me. And based on how behind I am that day, like if they're late and I'm late, who cares? You can be seen. If I'm on time and the rest of my day is absolutely packed, I can't, but I get to decide. And I kind of like that, but what's the vibe at this office? Good to know, and how it'll fit with you, because you're going to be different than me. I thrive in a little bit of chaos, apparently. Do you have your own panel? Again, another one that probably should have gone in the beginning. Or do you share all your patients with the whole office? So this is going to be like people, not that people can't go see other people in the practice, but like, is this kind of like, you're the touch person for this and you're going to manage most of their care? Or are you bouncing back and forth between the physician that works there, like if you're an NP or a PA in a state that requires oversight, or are everyone just comes and goes and sees who they please? What's the vibe there? It can be challenging if you're sharing with a lot of people because your treatment plans might look a little bit different. And if they don't chart very well, that can be challenging. But it's also nice to get fresh eyeballs on things. So it really just comes down to your preference. I prefer to have my own panel and then just pull people in as needed for like extra guidance, but you do you. And last, we're going to ask a really nosy question. Okay. So when you first went into this interview situation, you probably Googled the office first, right? If you didn't, you should. And what if you see really weird Google reviews? Most of the people who write Google reviews is because they're mad. But I have asked in interviews if they all have a theme. So I was looking the office up and I did see some of the Google reviews, which I do know people on Google reviews can be something else. But there did seem to be a little bit of something of the front desk staff is never there. Is that kind of still going on? And that's important to suss out only because you working there puts your reputation aligned with the office's. And if the office has this a reputation in the area of being kind of like all these weird things are always happening, and then they're like, oh, you work there, like that automatically aligns you with them. Your name is going to be there. Your reputation is important. So it's okay to say like, hey, I don't want to be affiliated with someone who is also trying to be seen well and do a good job. So I asked at this current job, I was like, there's this weird Google review, and they were like, oh my gosh, yes. And we were able to talk about it and flesh out. And it turned out to be one of those things where people are just frustrated at healthcare. And sometimes all you can do is take it out on a Google review. And I was like, I get that. Okay. But I got a better idea. I felt much more comfortable going into the situation. And they didn't really seem thrown off by it. If the people are thrown off by you asking about the Google reviews, that's probably another red flag. Okay. I think those are all my questions. I know that was a lot, but clearly I've learned a lot in my day and wished I had asked a lot of these a lot sooner. And things might be a little bit easier. I hope it makes your interview process a little bit easier. If you have any other questions that you like to ask in interviews, please leave them down below. I hope you have a beautiful day. Your interview goes well. You got this. Ask all the questions. Okay. You should be asking more questions than they're asking you because it's a joint process here. Okay. You deserve a job where you're going to thrive and they treat you well. Have a great day. Remember, you are not alone. You are more than enough and you can do hard things. And I'll see you next time. Bye.